Hello, everyone. Today we'll be revising rational emotive behavioral therapy, that is REBT. And for our revision, we would use a question from the specimen paper from the papers that we'd have in CIEs from 2024 onwards. So I've picked this question from paper three. Remember, in paper three, you have to attempt 8 questions, 4 questions each from the component that you've studied. So if you're a student who has prepared for clinical psychology and health psychology, you need to attempt 4 questions from here, and you need to attempt 4 questions from here. And bear this thing in mind, you do not get any choice at all. That being said, if we quickly move on to the question over here reads, James. James has the mood or affective disorder. Now, before that, remember this is this is a 4 mark question, and for this 4 mark question, you get 6 minutes in total to attempt this. I would suggest for the first 2 minutes at least, think first, try to figure out what the question is demanding from you. Spend that time, and trust me, it is worth it. It's going to ensure that you're not making any mistake ahead. So, moving on, James has a mood disorder and has started receiving rational emotive behavioral therapy. So, one, I need to know what unit is this from. Number two, I need to be identify I need to be able to identify as a student what particular part of the unit is this from. So now we know this particular paragraph is from the treatment and management of mood disorders. So James has a mood disorder and has started to receive rational emotive behavioral therapy, that is REBT. At the first session, James tells the therapist that he has been having problems at work. So there's this person with the name James. He has mood disorder. He has started receiving REBT. At the first session, he tells the therapist that he has been having problems at work. He feels that he has nothing to contribute to his team. He also thinks that his manager does not like him, and this is causing him distress. Explain how REBT can help James with his distress. Now, by now, all of you would know that for you to be able to answer this question, you need to have a thorough understanding on REBT. Now, to be able to answer this question, let's quickly revise what REBT over here is. Now, as I talk about REBT, what is REBT? REBT is a cognitive behavioral therapy. REBT is a cognitive behavioral therapy. And when we talk about this cognitive behavioral therapy, remember the core principle, like always has been, it is irrational thoughts. It's your irrational, illogical thoughts that are causing you trouble. So Albert Ellis placed this belief at the belief of stoicism at the core of his theory on how depression should be recognized and treated. A person becomes depressed as a result of internal constructions. Now, according to Albert Ellis, individuals, us as an individual, we become depressed because of our internal constructions. And when I use the word internal constructions, we're talking about a mind, we're talking about a cognitions, perhaps our illogical, irrational thoughts are leading towards us being the way we are. So a person becomes depressed as a result of internal constructions because of their perceptions and attitudes towards things that happen to them in their lives. So what we understand from here is it is not what happens in your life, but it is your perception. It's the perception you hold about what has happened in your life. It's the attitude that you carry about what has happened in your life is puts you where you are. Now, according to Ellis and to REBT, the vast majority of us want to be happy. I'm sure everyone would agree. The vast majority of us would want to be happy. We want to be happy whether we're alone or with others. We want to get along with others, especially with one or two close friends. We want to be well informed and educated. We want to have a good pay and we want to enjoy our leisure time. And I don't think there's anything wrong with us wanting all of this. However, according to Ellis again, of course, life doesn't always allow us to have what we want. When our goals are blocked, we can either respond in a healthy and helpful way, or we can react in a very unhealthy and unhelpful manner. So, putting it all together, what we've spoken about is us as individuals, any layman, any common person would always want the best things to happen to him or her in life. However, if these goals are blocked, or however, if it doesn't really turn out the way we expect it to turn out, it is on our discretion now. We either react in a healthy and a helpful manner, or we react in a very unhealthy and an unhelpful manner. So rational beliefs lead to functional consequences, while irrational beliefs would lead to dysfunctional consequences. So we expected good from life, and if life does not really give us good in return, we would either act in a very functional manner by staying healthy and helping ourselves, or on the other hand, we could turn into or another or on the other hand, yeah, on the other hand, we could react in a very unhealthy and unhelpful, irrational manner, which would lead to dysfunctional consequences. Now, what is the goal of REBT? The goal of REBT is to help people change their irrational beliefs into rational beliefs. How does this work? Changing beliefs is the real work of therapy and is achieved by the therapist disrupting the client's irrational beliefs. So, what does the therapist have to do over here? The therapist is expected to disrupt or dispute the client's irrational beliefs. For example, the therapist might ask, why must you win everyone's approval? Where is it written that other people must treat you fairly? Just because you want something, why must you have it? When the client tries to answer the therapist's question, he or she might not have any absolute or any rational reason. So, when the client tries to answer the therapist's questions, he or she sees that there is no reason why he or she absolutely must have fair approval, fair treatment, or anything else that he or she wants. So, we are talking about a situation when life does not give you what you expected from it, and which might consequently lead to us acting in a very unhealthy and a very dysfunctional manner. So what the therapist would try to do now is the therapist would try through REBT to dispute your irrational beliefs, to dispute or to disapprove your irrational beliefs by cross questioning you. I mean, why do you think you deserve the best? Why do you think the people around you to be nice to you? Why do you think you should get the pay that you want? Now, when the client tries answering these questions, the client realizes that he or she does not really have any sort of logical reasons behind those irrational beliefs. Now, taking this ahead, Albert Ellis and REBT contend that although we all think irrationally from time to time, we can work at eliminating this tendency. It is unlikely that we can ever entirely eliminate the tendency to think irrationally, but we can reduce the frequency here. See, we're all humans. We cannot 100% eliminate the tendency to think in an irrational manner. However, we could try to the best of our capacity to reduce this frequency, to reduce the frequency, to reduce the duration, and to reduce the intensity of our irrational beliefs. So, while Ellis accepts, acknowledges, realizes that humans being humans, we might not be able to 100% eliminate the tendency of having irrational beliefs. What we can do here is we could try to reduce the frequency, the duration, and the intensity of these irrational beliefs. Taking this ahead, in the REBT, the therapist helps individuals to understand the process known as the ABC model. Now, initially we talk about ABC, then we'd move on and bring in D and E over here as well. A, B, C, and I'm talking about adding D and E to this as well. So the most important element of the model is B, that is one's belief about the event. This is because while we all experience adversity and setbacks to some degree, Ellis argues that it is how we think about those experiences that have greatest impact on our emotional well-being and behavioral outcomes. People who consistently develop negative, fixed or irrational beliefs are at a greater risk of depression. So if I may give you an example over here of the ABC model to begin with, and then we'd add the D and E part to this. So if what does A mean over here? What does B mean over here? And what does C mean over here? So A over here is activation of an event, any adverse event. B is the beliefs that you carry about that event. And C are the consequences. What does it lead to? So if I talk about this example, an individual, let's just say, has been unsuccessful at a job interview. This is the triggering point. This is where the event got activated. Activating event or adversity in one's life. B over here, if this individual who has had an unsuccessful job interview, let's just say this particular individual now believes that I'll never get anywhere. I'm just not good enough. So when someone starts believing like this is, see, the B part, that is the belief that you carry. The beliefs about the activating event which lead to emotional and behavioral problems. And C, what is the consequence now? Feeling sad, tearful, or angry, withdrawal from friends and family, right? Now, which, and this could be refusal to apply for other works. Now, you saw how something happened, what you felt about yourself, and what was the consequence to it. Now, having said that, let me try adding D and E over here, and I'll tell you why I've added D and E over here, even when it is not present in your book. So, A, like I said, was activation of an event. B is about the beliefs that you carry about that event. C has to do with the emotional consequences to that. Now, why is it that I want to add D and E over here? Because remember, I was trying to explain you this case of a gentleman known as James. James is getting rational emotive behavioral therapy done. Now, what does D understand, or what does D over here refer to? D has to do with the disputing. D has to do with James being taught how to dispute or how to challenge that irrational belief. Remember, James felt his contribution at work was nothing. Remember, James felt that his co-workers, or if I may recall it correctly, I think it was the boss doesn't really like him. So this particular thought, this particular belief needs to be disputed, and hence I'm bringing in D over here. Now, D is disputation to challenge irrational beliefs, leading towards E. Now, if the client has been helped by the therapist to be able to dispute that irrational belief, then you could move on and try to rectify it. You'd be able to rectify it. How? Effective new belief replace the rational ones. So we're talking about those irrational, illogical, maladaptive, disruptive beliefs being challenged, being disputed, and being rectified or being effectively replaced with more rational beliefs. Now, this was about REBT. Taking this ahead, if I show this question to you again, James has a mood disorder and has started to receive rational emotive behavioral therapy. At the first session, James tells the therapist that he has been having problems at work. He feels that he has nothing to contribute in his team and also thinks that his manager does not like him and this is causing him distress. Explain how. Now, this is the question, right? Explain how rational emotive behavioral therapy can help James with his distress. Now, for the helping part, remember D and E is required. Having a look at the marking scheme real quick. Award 3 to 4 marks for a detailed answer with clear understanding of REBT, which is linked to helping James with his feelings at work. Remember, for you to be able to score a 4 on 4 over here, you need to ensure that your knowledge on REBT is being applied correctly in the case of James, for Mr. James over here. So, taking this ahead, this follows the ABCDE model. Remember, like I said, this is even when this is not mentioned in the book, us knowing D and E is very important because this is when you're actually disputing that irrational belief and replacing it with something that is more rational, more logical. So, this follows the ABCDE model. Activating agent, beliefs, consequences, dispute, and effect. Okay, so this is written here. I might as well. A is activating, B is belief, C is consequence, D is disputing, E is effect. 1, 2, 3, 4, 5. Learn. 1, 2, 3, 4, 5. For full marks, these need to be implicit. There needs to be implicit reference to the D and E part of the ABCD model and how this will help James with feelings about work. So, how do you score a 4 on 4? For example, during therapy, James will be helped to identify the limiting beliefs he has about work that are causing his distress. The therapist will help James to identify alternative thoughts by challenging that or disputing the limiting beliefs. For example, if James says his manager does not listen to the new ideas to his new ideas at recent meeting because his manager doesn't like him, the therapist will suggest his manager may have been listening but did not respond to James. So you, as a therapist, are trying to dispute, you're trying to challenge that irrational belief, right? James can learn to exchange the limiting thought for this new, more rational thought and feel less distress as he no longer thinks his manager does not like him. That is the affect part. So, this is the part. Read this one again. For example, if James says his manager did not listen to his new ideas at recent meeting because his manager doesn't like him, that's maybe irrational. That is irrational. The therapist will suggest his manager may have listened but did not respond to you. So there's a possibility that the situation that we're talking about is an irrational belief being replaced with something that is more rational and that makes more sense. I hope this has helped. Thank you.